Hi, I'm Cush, Executive Editor of Rheumnow.com. I'm coming to you from the 2016 annual meeting of the ACR and ARHP here in Washington, D.C. I want to talk to you about an interesting presentation on pregnancy and the risk of infection. This data comes from Evelyn Vinay, Sasha Bernatsky, Jeff Curtis, abstract number 2049. It was presented on Monday of this week. And the title of the presentation was Serious Infectious Risk in Rheumatoid Arthritis Offspring Exposed to TNF Inhibitors. You may be aware of the fact that there are mothers who take TNF inhibitors throughout pregnancy, especially with inflammatory bowel disease, and that certain drugs may persist during the period of delivery, may affect the newborn child, and there's a report in the literature of a woman with Crohn's disease who was taking infliximab, who gave birth to a child who received BCG vaccination at 3 months at a time when the child actually had infliximab in its blood, and the child died from a TB infection. So the concern is that if the mother is on or exposed to a TNF inhibitor and gives birth to an offspring, is that offspring going to have a TNF inhibitor in play, and might it affect the newborn, very immature immune system's child's risk for developing a serious infectious event? And what these investigators did was they looked at 2 large commercial claims database market scan, over 60 million insured lives, and identified women with rheumatoid arthritis who had a delivery, and then they looked of their offspring, how many of those developed infection. A novel way of looking at a very difficult issue. Overall, over a 3-year period, they identified 2,455 patients, children who were offspring, obviously, to a rheumatoid arthritis patient. They matched them up with over 11,000 matched controls, and they looked for infection rates in the offspring versus the other offspring who were not born to mothers with rheumatoid arthritis on a TNF inhibitor. And in the end, what they did find was that there was no increased risk, that the event rate was very, very low. Again, the risk of developing a serious infection in the 11,000 was 2.1% during the early period in life, in the first 6 months. If you had RA, it was still 2%. If you were on a TNF at different times, it ranged from 1.8 to 3.1%. Overall, what they found was that the odds ratio, if you were exposed to a TNF inhibitor during pregnancy, of the child having an infection was 1.4, and the confidence intervals were wide and cross 1, suggesting it is not significantly increased. Sobering information, there were a total of, I think, 9 or 10 events. It's not known if any of those were opportunistic or mycobacterial infections. Further analyses are needed, but again, this is good information, especially for just the issue of serious infections occurring in newborns born to mothers who might have been exposed to a TNF inhibitor. So that's it for this particular report. Tune into Rheumnow for more news and good videos like this one.